right, welcome back everyone. Now we're going to begin looking at the pancreas, right? The pancreas. So the pancreas is an interesting organ in the sense that it has this kind of dual function. So it has both endocrine and exocrine functions, right? And we'll talk about exactly what that means here in just a moment, right? So you find the pancreas kind of situated next to the kind of behind the stomach, right? Situated next to the duodenum, which is part of our small intestine, and then also kind of next to the spleen as well. It's this kind of long, slender organ, right? The pancreas itself, again, we mentioned it has both endocrine and exocrine functions. So what does that mean? The exocrine part of the pancreas, when you think exocrine, think digestive system, right? Think digestion. It's secreting pancreatic juices and enzymes that are necessary for the digestion, the digestion of contents coming into the small intestine, right? Coming into the duodenum. There's a little duct called the pancreatic duct that leads into the opening of the small intestine, right? When you think of the endocrine part of the pancreas, the endocrine function of the pancreas, think again, just like any endocrine organ, it's producing hormones, right? It's producing and secreting hormone, and the two main hormones that we'll talk about are called glucagon and insulin, right? Glucagon and insulin, and so these are helping us to control and regulate blood sugar levels in our body, right? And we'll talk about which one is controlling which. Now you'll see that these come from different types of cells. There's a mnemonic that I came up with quite a long time ago, but it's GABI. So GABI. So glucagon comes from alpha cells. GA, beta cells produce insulin. So GABI. Glucagon, alpha, beta cells, insulin. Right. So those are the main hormones that we will discuss, right? So if we look at some of the gross anatomy of our pancreas, we'll see here, as we mentioned, it's kind of situated next to both the duodenum that we see here kind of in this pink red, and then the tail of the pancreas is situated next to the spleen. So in anatomical, in gross anatomy, dissection, finding landmarks and reference points is incredibly helpful for identifying other structures. And so if you can find the pancreas and you just trace it off to the right as you're looking at the pancreas, trace it off to the right, and you'll find the tail. The tail is typically situated next to the spleen, right? So that's a helpful way to find the spleen. And then the head of the pancreas kind of sits in this C-shaped curve of the duodenum, right? So you find the pancreas, you find the head, that portion of small intestine that runs right next to it, that's going to be your duodenum, right? If you look off to the right, I want to draw your attention to the bottom image, right? This bottom one down here. I like this image better than this one up here. You see two components of the endocrine, right? You see the exocrine pancreas and you see the endocrine pancreas, right? This round circular region here, right? What's called the pancreatic islet. This is the endocrine pancreas. It's the endocrine part of the pancreas, right? So again, it's producing insulin and glucagon, right? All of this dark purple tissue, all out here, this is the exocrine pancreas, right? So these pancreatic acini, or the single acinus, this is part of the exocrine or digestive system part of the pancreas, right? So producing digestive enzymes, digestive juices and fluids, things like that, right? Now, the majority of the pancreas is exocrine, right? The vast majority of the pancreas is exocrine in function, meaning it has its role with the digestive system, right? And a much smaller percentage of it is endocrine, right? So the endocrine portion, again, are these pancreatic islets. You may also see these pancreatic islets called islets of Langerhans, right? Islets of Langerhans, which is named after the scientists who discovered them, right? So you see pancreatic islets, islets of Langerhans. Those are referring to the same thing, the endocrine part of the pancreas, right? So if we look at the pancreas, right, and we look at its hormones, we know that insulin and glucagon are helping to regulate blood glucose levels, right? So normal blood glucose level is maybe 70, 75 to 110 milligrams per deciliter, right? And there's some variation with that, right? Our blood glucose levels fluctuate throughout the day, but what helps to maintain their kind of normal range, right? What helps to maintain this homeostatic range, right, is negative feedback, right? Is helping to control the big fluctuations in blood sugar, and that's why we use insulin and glucagon, right? So if we have a very high blood glucose level, right, so 130, 150, something like that, we're going to use insulin, right? So beta cells will be stimulated to release insulin into the bloodstream after food intake, right? So after we eat, we enter a state called the absorptive state, and insulin is a major hormone during this absorptive state to help us bring in this glucose that has entered our bloodstream, right? So insulin travels through the blood, leaves the bloodstream, it encounters its target cells, right? And remember, insulin is insulin a lipid soluble hormone, or is it a water soluble hormone, right? Remember, insulin is a water soluble hormone, right? So meaning it binds to its receptor on the outside of the cell, and it initiates this kind of cascade of events, the second messenger system on the inside of the cell, to then allow for the uptake of glucose into the cell, right? Which causes blood sugar levels to drop, right? And the decrease in blood sugar level stimulates beta cells to stop producing insulin, and now you've returned to homeostasis, right? Until they drop too low, and then you have glucagon come in and take over and do largely the exact opposite, right? So looking at some type of feedback loop is a good way to learn these types of processes, right? So again, here's this regulation of glucose, or regulation of glucose via insulin, just like we've seen with various other endocrine organs and hormones. So we have blood glucose levels increase, right? That's going to stimulate beta cells to begin producing insulin, right? Insulin will travel in the blood to its effectors, right? So these various effectors down here, so liver, adipose tissue, and most cells, right? To then begin uptaking, right? So bringing in glucose to decrease its level in the bloodstream. You also have insulin affect fat as well, so increased lipogenesis, so making new fat, right? Increasing triglyceride synthesis, increase uptake of amino acids for protein synthesis, and then increased glycogenesis, right? So glycogenesis is this process of taking glucose and forming it together to form glycogen, right? And so what that's going to do when you take glucose out of circulation and form it together to form glycogen, you're going to drop blood glucose levels, right? You're going to decrease it, right? And then likewise, you're also going to decrease glycogenolysis and gluconeogenesis. Both of these processes would increase blood glucose, and that's the opposite of what we want, right? We're trying to combat high blood glucose levels by decreasing it, and that's our net effect that we see here in with number 5, and that's the total negative feedback, right? Until, of course, we drop it too low, and now we're hypoglycemic, and we need glucagon, right? And glucagon is going to do largely the exact opposite, right? To help increase blood sugar levels, right? So whenever you think of these different hormones, think about the different processes that are going to occur, not just with glucose, but with other nutrients as well, so amino acids, fats, and how that's going to, how that hormone is going to regulate their levels, right? So you have various conditions that are associated with glucose, right? So most common one that we think of is diabetes, right? So diabetes mellitus, right? There is another type of diabetes that we won't talk about right now, but it's called diabetes insipidus, which is different, okay? So this is an inadequate uptake of glucose, right? And so chronic hyperglycemia, right? So in other words, chronically high blood glucose levels can result in damage to blood vessels. And so you can end up with macrovascular and microvascular damages to blood vessels because of the blood vessels' prolonged exposure to these high blood glucose levels. And so you can get issues in very small peripheral blood vessels in the extremities. You can get issues in the eyes. You can get issues in the kidneys, right? So diabetic nephropathy, diabetic retinopathy with the eyes. So it can be a very serious thing. I remember doing clinicals one time. We had a patient who had diabetes, chronic, very poorly controlled, poorly managed diabetes, and he had already lost one leg, and I forget at what level the leg was lost, but he was in the hospital for an amputation of the second leg because of poorly managed type 2 diabetes mellitus, right? So speaking of the different types, we have type 1, right? So type 1, this is what you typically see in younger individuals, right? Typically see in younger individuals, and this is thought to have an autoimmune cause, right? And so this is due to some type of damage to the pancreas, right? So there is some type of damage to the beta cells in the pancreas that results in their decreased ability or inability to produce insulin, right? So because of this, because they're not producing adequate amounts of insulin, they have to receive insulin on a daily basis, right? They have to receive injections of insulin and closely monitor their insulin levels, right? Now, you also have type 2, right, which used to be called adult onset diabetes, right? That's not really the term that's used anymore. So type 2 diabetes, because it's not always just in adults, right? Young children can actually have type 2 diabetes at times, right? And so this is due to a decrease in insulin release or insulin ineffectiveness. So you've lost sensitivity to insulin, or it's no longer functioning, right? And this is the one that we typically associate with lifestyle trends, right? So obesity, poor nutrition, poor weight management, things like that, right? And so this is, again, usually occurs in adults, older individuals. So that's why it used to be called adult onset diabetes, but again, that's not the term that's really used anymore. But it can also occur in young individuals and young adults as well, right? So this is treated with lifestyle changes. So namely things like diet, exercise, and then potentially medications. This could be insulin. It could also be other medications that help your body produce insulin or use the insulin that's already there, right? But this type 2, again, this is what you typically see in older adults, right? You also have one called gestational diabetes, right? So gestational diabetes is a form of diabetes that occurs during pregnancy, right? And so with this, if you think about what's happening during pregnancy, right, there is an increased nutrient need for both the pregnant mother, but also the fetus, right? Because both have nutritional needs, and so the nutritional requirements of the mother have now increased, right? And so the development of gestational diabetes during pregnancy actually increases the risk that individual will develop type 2 diabetes later in life, right? It doesn't mean that they will, but it increases the likelihood that they will, right? And so that's something to be aware of. And again, if you have gestational diabetes, this is, again, uncontrolled blood glucose levels in the blood. It can actually damage the fetus as well. It can cause harm to it, and then result in complications to the labor and delivery process as well, right? So for hypoglycemia, right? So all of those were kind of associated with high blood sugar, right? With the role of insulin. Hypoglycemia is on the other end of the spectrum. This is low blood sugar, maybe below 60 milligrams per deciliter. And if you're working on a hospital unit, your criteria for hypoglycemia may be different than a different unit, right? So you may have a standing protocol for treating blood glucose levels below 60 or 65 or something like that, right? And so with this, it can be caused due to insulin overdose, right? So you take insulin, but then you don't consume anything, right? Prolonged exercise that's using up glucose in the body for ATP production and protein synthesis. Alcohol use as well. and then some type of liver or kidney dysfunction as well, right? Deficiency of glucocorticoids, growth hormone, genetics can all contribute to hypoglycemia. So what you typically may see in a patient who is hypoglycemic is hunger. Their cells are being starved, right? Dizziness, confusion, sweating, sleepiness. And so in this case, glucagon can be delivered. If the patient is conscious, they can drink a sugary solution, right? Apple juice, orange juice, something like that, to help to increase their blood sugar levels, right? So with regards to glucagon, right? Glucagon is going to come from the alpha cells, and I'm just going to go ahead and show you the same image that we've looked at from several other organs and hormones. But you can see here in this case, now we're dealing with a decreased blood glucose level. Whenever we did insulin, this was blood glucose level increase, right? Now we're decrease. So we're going to go to the alpha cells, right? Remember the GABI, G-A-B-I, glucagon comes from alpha cells, right? We're going to release the glucagon, and it's going to act on its effectors, again, primarily targeting adipose tissue and fat, right? Notice it does not affect protein, right? It's not affecting protein synthesis or protein breakdown, right? So in this case, we are acting to increase glycogenolysis and increase gluconeogenesis. This is the breakdown of glycogen, and the gluconeogenesis is the production of glucose from a non-carbohydrate source, both of which are promoting the increase in glucose. Glycogenesis, right, this would decrease blood sugar, right, and that's the exact opposite of what we want. We're already decreased in our blood sugar, so we need to decrease this process, right? And then we're going to increase lipolysis and decrease lipogenesis, again, freeing up fatty acids, freeing up our triglycerides, right? All of that effect is going to cause blood glucose levels and glycerol and fatty acid levels to increase in the blood. And of course, this process is regulated by negative feedback, just like we saw with the insulin process, right? So again, pretty much all of these hormonal feedback loops are going to be controlled by some negative feedback process, right? So consider these questions. We will stop here, and then we will pick up and we will look at our parathyroid glands.